Big Pharma's $13 billion problem. When pharmaceutical companies say that they need sky-high drug prices to find innovation, they never mention that the key piece of their spending puzzle is advertising. We see big pharma pouring billions of dollars into advertising and marketing. Sometimes they do this at greater numbers than science and research and development. Slick TV commercials, glossy magazine ads. But what if they redirected that spending into science? Joining me at this time for the first time is someone known as Maha Jersey Girl. She's a lifelong health advocate and strategist. She is the founder of Health Revolution USA, and she is the mother of two children with cystic fibrosis. Let's welcome Jacqueline Capriotti. Jacqueline, good to have you with us. Now, you have written an article on this exact topic. It caught my eye, and we reached out to you. What's your take on this?
Well, thank you for having me on, Rick, and giving me this opportunity to speak about this, what I find extremely important. As you mentioned, both my children have cystic fibrosis, and that is a progressive, life-threatening disease. Starts from the day that they're born. So it's a constant fight between getting the right medication, the coverage between insurance, clinical trials, FDA, trials to get things approved for them, which we've been successful and unsuccessful, life-saving surgeries, prior authorizations. I've been through the gamut. I've gone through the system. I've seen the underbelly of it. I've seen the miracles, and I've seen the bad stuff. Let's put it this way. So, as far as what I wrote in this article is the amount of money that is invested in pharmaceutical advertising is astronomical. And like you had mentioned, it does cut in the potential of advancements in medicine and also supports for the patients as well. So what I see is as we're one of two countries in the world that do are legally able to advertise pharmaceuticals, and that is our country and New Zealand. But New Zealand doesn't even come close to what we do. So we are extremely good at these ads. But how many times do you watch them? And they're so, number one, ridiculous most of the time. And do you really feel compelled that you can trust that commercial to go to your doctor and get real sound advice like, hey, doc, I want that pill. It looks like that. Is this why they're investing in this?
Jacqueline, it's interesting you say that because every time I see a pharmaceutical ad, which is every day, I ask myself, does anyone ever pick up the phone and say, hey, I'm going to do that? It's never entered my mind in my life. Do you have any feedback on that or people responding to these ads? You would think they were,
right,
if they keep pouring dollars into it.
Well, to be honest, I have gone to my doctor for even my own health issues, and once in a while I'll say, hey, I saw this ad that was on there. What do you think about this drug? And actually, most of the time your insurance doesn't even cover that. So why are they even putting that out there? A lot of time they're brand new drugs that are out there, so they're trying to pump up new attention to that. So I'll give them that a little bit. But the percentages of that they're investing in it to really drive up sales, I don't buy it because the math doesn't really pan out. It doesn't really show that the investment is there for the farmer.
Why are they putting that money in there, do you suppose?
Well, I'm not going to speak for them, but as a ravenous consumer of the medical system, I think it's very interesting that they invest a lot of that advertising time during news time. So why are they taking that prime time, aligning it in the commercial breaks when they have, news we cut away, and then we're supposed to be reporting non-biased.
Yeah, so go ahead.
So you're trying to report on something. So even like with COVID, when it was coming out, and then you're going to cut away to sponsored by so and so, and this glossy, fancy little commercial that everybody looks happy walking off into the
Yeah.
sunset. Uh, I don't know. I question,
So,
and
so,
I think a
so,
lot of people are.
so what they're doing, you're surmising, is influeing how the news gets reported.
I believe so. I
That makes
think
sense.
that,
That makes sense.
let's put it this way, even if they're not, that's not the intention. So I'm going to be very kind right now. Even if that's not their intention, they still are influencing it.
That's right. That's a great point. Great point. How much influence they have over a doctor's personal recommendation? How much financial influence does a doctor, if any?
Well, I mean, there's been some laws that have changed, which are great. That, before where the pharmaceutical companies could wine and dine the doctor, take them, give them gifts, take them on lunches, and take them to, golf outings, things like that. There has been some laws that have prevented that from being the case anymore. I mean, it used to be just an absolute open fest where they could do whatever they want. So some of those things have dialed back, but their influences do have a big influence on the insurance coverages, as far as that goes. So, how many times have I been able to have a drug that has been prescribed by my doctor? This is the drug that he wants me to be on, and then I'll go, and the insurance says no. You have to use this one. And then 6 months later, they pop it to the one he originally had prescribed to me. So it's like, what's going on here? So, yes, they do have an influence. They have an influence also on the medical establishment. So, the larger hospitals, the larger ones that they have, because they fund a lot of the science there. They fund a lot of they support a lot of the actual buildings. Their names after them. Their brands are a really large influence. And that's the thing is that influence is woven in and out of the whole entire system.
Wow, that's scary.
Oh, absolutely. But, I see a potential that that influence can be used for good. And sometimes it is. But I believe that that influence can be used for good. So instead of investing so much money in advertising, how about pulling back? So if you are going to put something out on the news, use that time to educate the public, not necessarily pitch your drug, but
There you
educate the
go.
public
Yeah.
on awareness of the condition, prevention that you can do. You can actually talk about even the drug that you are, representing, but there are so many different preventative measures like heart disease, diabetes. There are things that you can improve in your own diet. I would love to see the pharmaceutical companies investing in that more in their media broadcasting part of their advertising piece of it if they're going to continue to do that.
But isn't there a conflict of educating people to adjust their diet because now they may not need to use the pharmaceutical?
Potentially, yes, but frankly, it's not sustainable in the way that we're doing things right now. So, yes, so they're cashing in the dollars now, but do we really need so many like, GLP-1s that are out there that may be servicing new people, but now they have such a large array of portfolio of them. Wouldn't you, and even if somebody needs to end up using that, it may work a lot better if they are using it in conjunction with better diet and exercise. So they can go in hand. And frankly, I think the biggest thing is that the public will gain more trust in pharma, more trust in the medical system.
Yeah.
And that is a lot long-term sustainable than the dollar that they're going to make at their that quarter or that year end.
Do you happen to have any direct communication with RFK Jr. or those around him?
Those around him, yeah. So I did work on the Kennedy campaign. So I had wore many different hats, but a big part of it was I was doing a lot of health initiatives for the campaign and patient advocacy. So I was the national director of outreach in patient advocacy and helping building that trust for the patient and the provider. That trust between the patient and the provider, that Hippocratic oath that the doctors have taken from the time that they had graduated university, all that time and money that they put into their profession, really has been degraded and eroded by the medical system. And trust me, most doctors, they don't go into this profession because they want to make a big buck. It takes them many years to get to that point, even if they ever do, because there's so much debt, so much energy that they put into it. I don't know much 16-year-olds that are saying, I'm going to go to pre-med and become a doctor or an orthopedic surgeon because I want to get rich. It's that a lot of times the stories is that, my brother was injured in a sport, while he was playing sports, and it compelled me, or I was myself, and it compelled me that I wanted to help others to become that. But then the system has come in between the patient and the provider of health. And, it has really eroded that trust. And it is so toxic for us because we need our doctors. We need better health. We can't do this all on our own. And frankly, the doctors are having their hands restrained and by
Jack,
the institutions they work for.
I have been told by someone that is a mental health therapist, I don't know if it's the right choice of words, but that the medical profession has the greatest number of uh, workers, quote, doctors, who are depressed and need outside mental support than any other profession in the country.
I don't know about any other profession because farmers also have a very high rate of suicide and depression as well. There are multiple different, even police officers. So it's basically a lot of times our frontline workers, the ones that we are really depending on for our livelihood. Our medical providers, our farmers, our law enforcement. They all have high rates of suicide, high rates of stress, and then on top of it, they have society looking down on them, where they don't get the respect that they really need. They don't get the supports that they really need to be able to do their job that they really want to do and that they've sacrificed so much to get to that point. And
Okay.
you're absolutely right. So residents, med students, even doctors who have been in those professions for a long time, nurses, all of them, they're really they're on a lot of stress. The system itself, like it cannot keep up with this chronic illness epidemic. They cannot sustain this. There's so much pressure, and then the hospital funding as well. Like I said, the whole system is not sustainable. The program is not sustainable for pharma, for hospitals, for these big systems on it. It's just not going to be able to continue like this.
Okay. When you say not sustainable, are you talking the money? You're talking
Well,
what's not sustainable?
Well, kind of all the above. So let's put it this way. If we have 40% right now, which I think is even more, of our children have a chronic disease, at least one chronic condition, where are they going to be at when they're ready to go into the into the workforce? Where are their health outcomes going to be when they may want to be serving in the military? When these children become 18, 20, 26, 30 years old and need to be active, participants in society, contributing to society, they're not going to be healthy enough. Many of them are going to end up being on the system, on Medicaid, on Social Security and disability, and rightfully so, because they won't be well enough. And that is just not sustainable. We can't.
Got it. Okay. Now, Jacqueline, let me ask you this. As you say, Big Pharma is spending money in advertising. They should be spending it elsewhere, or at least educational ads.
Mhm.
Do you see anything changing under this administration while RFK Jr. is where he's at.
100%. 100%. I definitely love the fact that the new administration between Trump and Secretary Kennedy is really focusing on reducing the chronic illness. As I mentioned, it's not sustainable. We need to have our next generation as healthy as possible and focus on food, on nutrition, so they get a better head start on a quality of life. On Operation Stork, where the president has put that out through Secretary Kennedy, where we're going to have healthier pregnancies. We're number 4, I believe, in pregnancy, in maternal death in the
Hmm.
world, in the
Well,
developed world. We are
I wish
number
I wish
4.
the administration would get that word out. I've never heard that until now. I wish they would get that word out there.
That's crazy to me. I mean, that's absolutely crazy. And I live in New Jersey, and we're one of the top in the country. And there are some people talking about it, but frankly, uh, I would like to hear more people from the Republican side talking about this. This is serious. This is, you know, many Republicans, many in the GOP are pro-life. We need to protect that life in at all measures.
Yeah.
So we need to make sure that that life, while it's growing, has a better outcome. And then also the infant death mortality rate is extremely high, especially in the Black community and underserved communities, extremely high in this country. So I do like the fact that their Secretary Kennedy and Trump has invested it right at the get go of this new administration. That was one of the first things that they implemented was Operation Stork, where they were going to improve the nutrition quality of the foods that and for moms, and but there has to be so many more things to do.
Yeah.
And infant formula too. So they're really helping reformulate the standards on the infant formula for this country.
Jacqueline, where can our viewers find you online?
So you can find me on Health Revolution USA. So pretty much all social media outputs, you can find me on that. On X, I'm a Maha Jersey girl.
When I saw first time we've spoken, when I read Maha Jersey Girl, I expected to hear an accent, Joyzy.
I'm actually originally from England. So
Oh, okay.
I was born in England, and my mother's Romanian, my father's English. Most of my early childhood, I emigrated here when I was 8 years old, and I grew up in northern Jersey. So I have like this combination of everything, and I lived in the South too. So I lived in North Carolina and Florida. So I'm just a conglomerate of it all.
All right. Jacqueline Capriotti, the Maha Jersey Girl, founder of Health Revolution USA. Thank you for joining us.
Thank you, Rick.
Back with more after this.